To splint a leg, you do the same thing that you would do with a arm, so you splint above and below. Shows you here how to put a sling on. That's pretty self-explanatory. You take that triangle bandage and tie a knot in the end. There's several steps here for sling. So step 1 is to support the injured limb above and below the injured area. Step 2 is to check the injured area for circulation. So like we did for the arm splint, feeling of warmth and color. You can kind of pinch their skin a little bit and see if the redness goes away and returns. That's an indication of circulation. Position the triangular sling, or say I always have a large handkerchief in my pocket anyway, so I would use that if I didn't have a clean triangular sling available. Bring the upper free end of the sling behind the neck and lower the free corner upward as shown here, and tie the ends together with a square knot forming the sling. We use a square knot there because any kind of a slip knot will come loose. To keep the injured area more stable, you can bind the sling to the chest using a second triangular bandage, and that shows you the picture here. And again, use a square knot there. And then step 7 is to recheck the area for feelings of circulation. Head, neck, and back injuries. This one we're going to spend a little bit more time on because this one is a much more severe injury than a broken arm. So you can take it from me. I've had some back surgeries and stuff. You don't want to mess around with anything like that. It's generally a fairly painful thing. The backbone or spinal column is made up of small bones called vertebrae that surround and protect the spinal cord. If a vertebrae is broken or dislocated, the spinal cord may be injured. Fractures of the head, neck, and back are extremely dangerous because movement might further damage the spinal cord and cause permanent paralysis or even death. Whenever someone has fallen, been involved in an automobile accident, or suffered a blow to the head, assume that there is an injury to the head, neck, or back. Such injuries are often not easy to detect. The victim may or may not be suffering from pain, paralysis, cuts and bruising, or swelling. The injured area may not be deformed or abnormally shaped, or there may be no symptoms at all. Someone with a head injury might be disoriented, irritable, confused, or combative, symptoms that can be present right away or might develop over time. So always proceed with caution when you're aiding a person who you suspect has a head, neck, or back injury. The steps for treatment of a head, neck, or back injury are: step 1, stabilize the head and neck of the victim until it can be determined whether the spinal column has been injured. A first aider or bystander can hold the victim's head and neck steady. If the person is wearing a helmet, do not remove it unless it is necessary to access the person's airway. Step 2, provide urgent treatment if necessary. Step 3, do not move the person or let him or her move unless threatened by an immediate danger, such as a fire, potential avalanche, highway traffic. Step 4, if the victim is having trouble breathing, gently adjust the position of the head and neck just enough to maintain an open airway. Do not put a pillow under their head. And treat for shock is step 5. Whenever you suspect a head, neck, or back injury and the victim must be moved to open an airway or to get them out of danger, ask other scouts or bystanders to help. You want to try to keep their body in the same position you found it, so as many people as you need. Use a backboard if you have one that's just kind of like a stretcher that's just a board, just flat. You don't want to use a typical stretcher like I showed you because they can kind of dip in and it'll move them. We're going to move on to the cold and heat related conditions and injuries. These are ones that happen at camp fairly regularly because we're out in nature, outside, susceptible to the weather, and a lot of people, especially younger scouts, don't know how to prepare themselves for the heat, say at summer camp. So we're going to start with hypothermia. That occurs when a person's body is losing more heat than it can generate. It is a danger for anyone who is not dressed warmly enough, although exposure to cold is seldom the only cause. Dehydration is a common contributing factor to hypothermia. This is not something that you often think of when you think about getting cold, but you need to make sure to drink enough water, even if it's cold outside. So when I spend long periods of time, say hunting in the late fall or winter when it's really cold, I try hard to stay hydrated, and it's something that I had to learn as I got a little older, but that does help. Your organs, your body needs water to make heat. So wind, rain, hunger, and exhaustion can further compound the danger. Temperatures do not need to be below freezing either. A hiker caught out in a cool, windy rain shower without proper rain gear can be at great risk. A swimmer too far out in chilly water or a paddler who capsizes are also at risk for hypothermia. First aid for hypothermia. They might experience numbness, fatigue, irritability, slurred speech, uncontrollable shivering, poor judgment or decision-making, and loss of consciousness. Shivering that stops without rewarming is a sign that the person's condition is worsening. He or she might need immediate medical care. Treat hypothermia victim by preventing the person from getting colder. So blankets, sleeping bags, anything that you can use to make them better suited to fight the cold. After summoning help, use any or all of the following methods to bring the body temperature back up. If fully conscious and able to swallow, have the person drink warm liquids. Anything that you get your hands on, soup, juice, water. But you want to stay away from anything with caffeine or alcohol because that can make the condition worse. Move the person into the shelter of a building or a tent. Remove the wet clothing and get him or her into dry, warm clothes, or wrap the person in blankets, clothing, or anything handy that can be used like jackets or a sleeping bag. Wrap towels around water bottles filled with warm fluid, then position the bottles in the armpit and growing areas. We do that there because that's the spot where some of the bigger arteries are closer to the skin, so you're basically warming the blood up. Monitor the person closely for any change in condition. Do not rewarm the person too quickly, for instance, by immersing them in a warm bathtub. Doing so can cause an irregular and dangerous heartbeat. Frostbite occurs when a skin is exposed to temperatures cold enough that ice crystals begin to form in the tissues. A frostbite victim might complain that the ears, nose, fingers, or feet feel painful and then numb, but sometimes the person will not notice any such sensation, which is, in my case, I didn't. It was cold outside, but I didn't notice any particular sensation in my toes. Grayish white patches on the skin, indicating that ice crystals have begun to form in the top layers of the skin, are signals of the first stage of frostbite or frost nip. With continued exposure, frost nip worsens and the freezing extends to the deep layers of the skin and to the muscles. Frostbite can be very dangerous and very serious as it can cut off blood flow to the affected areas and lead to gangrene or tissue death. Any spot that you have that's farther away from the body's core, fingertips, toes, the tip of your nose, tip of your ears, anything that's farther away from the warm blood flow, you're more susceptible there. In my case, it was a pair of boots that leaked, and they got my toes pretty good. If one person is being treated for hypothermia, chances are the rest of the group need to be checked. So that's just a side note here for the hypothermia. But first aid for frostbite here is if you suspect that the frostbite extends below skin level, remove wet clothing and wrap the injured area in a dry blanket and get them under care of a physician. Do not massage the area or rub it with snow. I'm not sure how that one got started, but it used to be a thing to rub it with snow. Rewarm the area only if there's no chance of refreezing. Expose the affected area to warm, not hot, so like 100 degree water until normal color returns and it feels warm, and then bandage the area loosely. To treat frost nip, move the victim into a tender building, then warm the injured area. If the ear or cheek is frozen, remove a glove and warm the injury with the palm of your hand. Slip a frost nip hand under your clothing and tuck it under your armpit, and again, that's your armpits or your groin or the warm areas. Treat frost nip toes by putting the victim's bare feet against the warm skin of your belly. Moving on to dehydration. This is one that I push, and we push really hard here at our summer camp. We have a loud PA system that you can hear all through camp, and on really hot days, we will sound a bell and every 15 minutes or so throughout the day on really warm days, and that's to a signal that you're supposed to stop and drink water. So if I'm way out in the south end of camp teaching a merit badge, I can hear the speaker, and I stop my class every time I hear it, every 15 minutes or 20 minutes, and whenever it goes off, and we stop and we drink water. This Saturday here in Iowa, it's supposed to get well over 100 degrees in heat index, and I know a lot of you guys in the south and the southwest are experiencing some really bad heat right now, so stay hydrated. The human body is 70% water, which is essential to maintain our body temperature. Vital organs like the brain and the kidneys will not function well with not enough water. We lose water mostly by breathing, sweating, digestion, and urination. That's one that people don't think about a lot too. Like in the winter, you're still breathing, and you know that you can breathe onto a piece of glass and it fogs up. That's because there's moisture in your breath. When we lose more water than we take in, we become dehydrated. Signals of mild dehydration include fatigue, increased thirst, dry lips, and dark yellow urine. Signals of moderate to severe dehydration include severe thirst, dry mouth with little saliva, dry skin, weakness, dizziness, confusion, nausea, fainting, muscle cramps, loss of appetite, decreased sweating, decreased urine production, and less frequent and dark brown urine. Your urine should be like a light lemon color. If it gets much darker than that, you're dehydrated, so that's a pretty easy way. Or if you're not urinating, that's a pretty easy way to know that you're not getting enough water. I'm outside today filming here, and I need to go get another bottle or refill my bottle here, but I have water with me. I'm talking a lot, so I got a lot of moisture going out. Luckily, it's not hot enough to sweat today, but here where I'm at in Iowa, but it's going to be this weekend. So, first aid for dehydration. To treat mild dehydration, drink plenty of water or a sports drink to replace fluids and minerals. Drink 1 to 2 quarts liquids, or 1 to 2 liters of liquids over 2 to 4 hours. See a physician for moderate to or severe dehydration. Severe dehydration requires emergency care. The victim will need intravenous fluids, so an IV bag, a needle in your arm that gives you fluids. Rest for 24 hours and continue drinking fluids. Avoid tiring physical activity. Although most people begin to feel better within a few hours, it takes up to 36 hours, or about 36 hours, to completely restore the fluids. Sports drinks help because you sweat a lot of salt out, and that's a lot of minerals and electrolytes that your body needs. You shouldn't be drinking so much water that your urine is like perfectly clear. That's a sign of overhydration. It's not nearly as dangerous as dehydration, but like I said, your urine should be about a light lemon color. Heat exhaustion can be brought on by a combination of dehydration and in a warm environment. Heat exhaustion is not uncommon during outdoor activities conducted in hot weather, especially if participants are not fully acclimated to the conditions. Signals of heat exhaustion include severe lack of energy, general weakness, headache, nausea, faintness, and sweating, cool, pale, moist skin, and a rapid pulse. This is one that we see at camp fairly regularly. Here in the summertime in Iowa, we'll get 100-degree plus temperatures, but the real problem here is that we have a lot of moisture in the air, a lot of humidity. As you guys, may already be aware, we grow a lot of corn in Iowa. The corn plant itself puts out a lot of moisture out of the ground. So we get what I call it the corn heat days. It's just, you're humid and hot and sticky and dreadful, and we get several of those days, or for a couple of weeks during the summer. So this is one that we run into at camp fairly regularly. First aid for heat exhaustion is to get the person in the shade or an air-conditioned vehicle or building. Encourage him or her to drink fluids such as cool water or sports drink. Out at camp here, we keep Pedialyte or Gatorade or Powerade. Any of those brands of sports drink will work. Apply cool, wet towels or cloths to the skin. Wet the person's clothing with cool water and fan them to help with the cooling process. Raising the legs may help prevent a feeling of faintness when the person stands. Usually after 2 to 3 hours of rest and fluids, the victim will feel better and should rest for the remainder of the day and be extra careful about staying dehydrated. On the other side of that, heat stroke is heat exhaustion that has progressed even farther, and it can lead to death. So left untreated, heat exhaustion can develop into heat stroke. In the heat stroke, the body's cooling system begins to fail and the person's core temperature rises to life-threatening levels, about 105 degrees and above. One type of heat stroke develops in young, healthy people from dehydration and overexertion in hot weather, especially in high humidity. Signals of exercise-related heat stroke can include any signals of heat exhaustion, as well as hot, sweaty, red skin, confusion or disorientation, a rapid pulse, shallow breathing, vomiting, or seizures. The other type of heat stroke usually happens in elderly people when the weather is very hot, especially with high humidity, and the signals are similar to the exercise-related heat stroke, except for the skin is hot and dry because there's no sweating. First aid for heat stroke. Heat stroke is a life-threatening condition. Call for medical assistance immediately. While waiting for medical personnel to arrive, work to lower the person's temperature. Move the person to an air-conditioned or shady area, loosen tight clothing, and further cool the victim by fanning and applying wet towels. If possible, immerse or spray the person with cold water. If you have ice packs, wrap them in a thin barrier, such as a thin towel or your neckerchief, handkerchief, sock, clean sock, anything like that. And again, that's to prevent frostbite of the skin from the ice pack, and place them under the armpits and against the neck and groin. If they're able to drink, give them small amounts of cool water. We are going to move on to burns here. I have had the pleasure of having several pretty nasty burns over my life. I've had third-degree burns twice. I can tell you it's not any fun. I worked in restaurants for a long time, so I had an accident with some hot fryer grease. Certainly can happen around your camp or around home. A spark from a campfire, boiling water, faulty wire, a mishap with chemicals, the rays of the sun, and are causes of many of the burns that we receive. Burns are generally characterized by degree or the severity of the skin and tissue damage. So superficial burns or first-degree burns, such as you might get from touching a baking dish, will cause a painful reddening of the skin. Sunburn is a superficial or first-degree burn. Superficial burns do not usually require further medical attention unless they cover more than 20 to 25% of the body. Remember to check the scene before you proceed. Always get a victim away from the source of the burn before proceeding with treatment. Partial thickness or second-degree burn affects the epidermis and part of the layer of the skin below it, the dermis. Partial thickness burns are more serious than superficial burns and include a reddening and blistering of the skin. So these are like the more severe sunburns that you can get that blister. That's actually a second-degree burn. Being scalded by boiling water is another example of an accident that can happen. To treat such burns, remove them from the source of the burn. Cool the burned area with a cold running water until the pain is relieved, and let the burn dry, then protect it with a loosely applied sterile gauze, pad, and bandage. Get immediate medical attention if the victim of the burns has trouble breathing, cover more than one part of the body or a large surface of the body, has caused possible burns to the airway, such as burns to the mouth and nose, like in a fire, affects the eyes, head, necks, hands, feet, or genitalia. If they're full thickness burns, or if the person is under 5 or older than 60, and if they're the result of chemicals, explosions, or electricity. In that case, you're going to want to dial 911 or get them to an emergency room. Do not apply ice or ice water to any burn, and it may cause further damage or cause you to lose too much body heat too rapidly. So, never break burn blisters. It creates an open wound. Do not apply butter, creams, ointments, or sprays. Treat thermal burns, like from scalding water, under running water. Full thickness or third-degree burns are very serious and potentially life-threatening. They destroy the epidermis and the dermis. A victim who has been exposed to open flames, electricity, or chemicals may sustain full-thickness burns. The skin may be burned away and the flesh charred. If nerves are damaged, the victim may feel no pain. When I got my third-degree burn on my leg, it was about the size of about that big, about the size of a small plate. It hurt, like, right away when I got the burn, and then didn't hurt, because it burns the ends of the nerves off. It hurt when it was healing, but when I did it, it didn't really hurt for more than just a second. So such burns constitute a medical emergency. Do not try to remove any clothing, as it may be sticking to the victim's flesh. Cool the burn by applying cold, moist cloths. After cooling the burn, cover the burn with a dry, sterile dressing, treat for shock, and seek immediate medical attention. Don't put any kind of ointment or anything on a severe burn. Chemical burns. I've never had a bad chemical burn. I've had some not very serious, like, first-degree chemical burns, but I've never had a really bad one, which is I'm glad for. Chemical burns can be caused by exposure of the skin or eyes to substances that are like strong acids or strong bases, such as model glue, drain cleaners, toilet bowl cleaners, metal cleaners, and battery acid. To treat it, use gloves or a piece of cloth, brush off any powdered chemicals, and remove any of the victim's clothing with chemicals on it. Do not contaminate yourself in the process. That's key. You don't want to make another victim. Immediately flood the area with cool, clean water and continue flushing for at least 20 minutes to remove the chemical. If the chemical has gotten into the eyes, flush the eyes with clean water. It may be easier to have the victim lay down while flushing the eyes with water. Act as quickly as possible and continue flushing for at least 15 minutes or until emergency medical professionals arrive. Anything with your eyes you don't want to mess with. You don't want to blind yourself, so flush it and get immediate help. Cover them loosely with sterile dressings or gauze, and then get medical attention. Damage from a chemical burn can take hours or even days to fully develop. For this reason, it is initially difficult to evaluate the extent of the burn. The most important first aid for a chemical burn is to dilute the exposure by continually flushing the area with water for at least 15 to 20 minutes, or until medical help arrives and tells you to stop. Remember that inhaling chemicals can also damage your airways. So for electrical burns, if electricity travels through part of a body, you can get an electrical burn. Besides a burn, too much electricity can even stop the heart from beating correctly or damage the internal organs. Superficial and partial thickness burns from electricity, like the burns from too much heat, the skin may look charred. Full thickness electrical burns may not leave charred skin. Instead, the skin can look leathery and white and be hard to the touch. Call 911, get medical attention if someone has an electrical burn. If you encounter a victim of an electrical burn, shut off the power at its source and call an ambulance immediately. Check the scene for safety and then proceed with the following. If you don't know how to shut off the power, don't mess with them. Don't touch them, because they might still be... people conduct electricity too, so if they're still in contact with a live wire, you don't want to touch them. You want to turn the power off. If you can't find somebody that knows how to turn the power off, then you just have to wait for medical assistance to arrive. All right, step 1, if you encounter a victim of electrical burn, begin CPR if they're not breathing, and get your AED, your automated external defibrillator if you have one. Cover the burns with sterile gauze, cool the electrical burns just like you do for thermal burns, and treat for shock. We're going to talk about fainting. Fainting is a brief loss of consciousness. Usually occurs because there's temporarily loss of blood flow to the brain. It can be caused by getting up too quickly, or for standing too long, by overheating or dehydration, by emotional stress such as fright or bad news, or by severe pain. Fainting can occur suddenly, and there might first be signals such as dizziness, nausea, paleness, sweating, numbness, and tingling of the hands or feet, vision blackout or whiteout, and coldness of the skin. The victim might fall to the ground. If a person begins to faint, have them sit down with their head between their knees, or lie down and raise the legs about 12 inches. We do that to restore blood flow to the brain. Someone who has fainted should be encouraged to stay laying down until he or she awakens and feels better. Raise the feet, just like you do for shock, 12 inches. Make sure they're breathing. If they begin to vomit while laying down, turn them on their side so that it keeps their airway clear. Support the head with a pillow, or let the victim rest on one arm. Loosen the clothing around the neck. Wipe the victim's forehead with a cool, wet cloth. If they're alert enough and might be dehydrated, give them fluids. If they don't awaken within 2 minutes or fully recover within a few minutes, get medical help. Hyperventilation. Hyperventilation happens when you are breathing faster and deeper than your body needs. Involuntary hyperventilation may be caused by severe pain, infection, severe bleeding, heart attack, cold water immersion, diabetic coma, poisoning, or such conditions as an anxiety attack. The victim can feel dizzy or faint and have numbness, tingling, or cramping in the fingers or toes. Involuntary hyperventilation usually requires immediate medical attention. Voluntary hyperventilation is unhealthy and can be dangerous, especially if it is followed by breath holding. A person who does this can pass out or faint from lack of oxygen before they feel the need to breathe. If this occurs while a person is underwater, the result can be drowning. Be alert to abnormal breathing patterns in individuals. All right, we're going to talk about seizures. If you ever see somebody have a seizure, it can be scary. It can be a pretty violent thing. They can thrash around pretty violently. So keep your cool. Ask people, for help, and ask people to call 911 for you. So a seizure is a change in awareness or behavior that is caused by abnormal electrical activity in the brain. In adults and children over age 6, seizures are usually due to epilepsy, which is a disorder of the brain. A seizure can be a signal of a serious medical problem. Seizures can occur in a person who is suffering from a head injury, brain tumor, stroke, poisoning, electrical shock, heat stroke, infection, a high fever, usually in children in that case, low blood sugar, or low blood pressure. Epilepsy may be the cause of a seizure. There are several common forms of epilepsy. In grand mal epilepsy, known as tonic/clonic seizure, the victim might lose consciousness and fall to the ground. The arms and legs stiffen, then jerk forcefully. Some muscles or the entire body can stiffen or twitch with sudden muscle spasms known as convulsions. The victim may bite their tongue. Do not put anything in their mouth. Victims will rarely bite their tongues with enough force to cause bleeding. It used to be how we recommended treating seizures was to put something in their mouth. It's a bad idea. Neck veins may be swollen and the face may turn red or blue. Breathing may decrease and is often loud and labored, accompanied by grunts or snorts with an unusual hissing sound. The victim may drool or foam at the mouth and may lose bladder or bowel control. Another kind of epileptic seizure is a petit mal seizure, which the person seems to briefly lose awareness of his or her surroundings and appears to stare into space. This behavior is often mistaken for daydreaming. Although awake, the individual does not respond normally. Afterward, the person does not recall the episode. Focal seizures cause one part of the body to jerk or twitch, and the person seems distant or unaware. Like I touched on before, seizures are frightening to observe. It is important to stay calm. While there is no first aid measure that will stop a seizure, you can provide good first aid by protecting the person from being injured while experiencing a seizure. Break their fall, if at all possible, and lower them gently to the ground. Move any furniture or hard objects away. Loosen tight clothing around the neck and waist. Do not try to hold them. Do not try to put anything in their mouth. Make sure their airway is open after the seizure is stopped. Place them in the recovery position, which is covered in your book here. We'll touch on recovery position here in a little bit. Let them rest. Keep curious onlookers away. If the person is not known to have epilepsy, if the seizure lasts more than 5 minutes, recurs, or causes injury, or if the person is slow to recover, get immediate medical attention. Recovery position. Place a victim who is unconscious but who is breathing normally in a recovery position. To do this, we're going to have to rely on your book here. You extend the person's arm furthest from you up next to the head in line with his or her body. Bend the nearest leg up to you. Support the head or neck as you grasp the victim's hip and shoulders and roll the person away from you so that they're laying on their side. This will prevent the person from choking on saliva or blood or vomit and will help keep the airway open. So, in your book, this is your picture of the recovery position here. Make sure to study that in your book. Practice getting into the recovery position. Practice putting someone in the recovery position. This is an important one. Know how to do. So grab a brother or sister that's willing, or an adult, parent, leader, whoever, and let them pretend like they're unconscious and put them in the recovery position. Even if the person is a great bit bigger than you, you can still do this because you're relying on the leverage from their shoulders and hips and arms and legs. So if they're still unconscious after 30 minutes, flip them to the other side. And that's to maintain the circulation. So moving on to diabetes. Diabetes is a disorder that impairs the body's ability to control its blood sugar level. In some cases, the body stops making insulin. Insulin is a hormone that helps the body use sugar for energy. Some people who have diabetes must inject insulin to live. People with diabetes who do not have to use insulin can keep their blood sugar at proper levels by watching what they eat and taking other diabetic controlling medications. When a person's blood sugar is too high or too low, the person can become unconscious. This is a diabetic emergency. A very high blood sugar level, which is hyperglycemia, will rarely cause death. A low blood sugar level, hypoglycemia, is extremely dangerous because without sugar, brain cells die quickly and permanent brain damage can result. Because it is impossible to know if there is too much or too little sugar without doing a blood test, all unconscious diabetics should be treated as though their blood sugars levels are too low. Warning signs of hypoglycemia, so low blood sugar, include headache, sweating, pale and moist skin, weakness, dizziness, shallow breathing, nervousness, and a rapid pulse. Signals of hyperglycemia, so high blood sugar, include extreme thirst, frequent urination, drowsiness, lack of appetite, and labored breathing. A diabetic person may be wearing a medical ID necklace or bracelet or have a card explaining what should be done in a diabetic emergency. The person might also carry some form of a concentrated sugar or glucose tablets or something of the sort to be taken orally if the low blood sugar is suspected. It comes in a tablet or a paste, and it's usually glucose as opposed to sucrose, I believe, because it's absorbed faster. Diabetics who use insulin sometimes have a low blood sugar level without becoming unconscious. This can happen if they take too much insulin, don't eat enough food, exercise a lot without eating a snack, or if they decrease their dose of insulin ahead of time or wait too long between meals. With mild cases of hypoglycemia like these, the victim is fully conscious and able to safely follow food and drinks. Give the victim fruit juice or a soft drink that contains sugar. So not diet soda. Liquids are going to absorb faster so that the body doesn't have to break them down. So that's why we do liquids instead of like a cookie. If that's all you have is a cookie or a candy bar or something of the sort, give them that. But juice or a soda is better. All right, moving on to foreign objects in the eye. Sometimes it's in the eye is not just painful, it can endanger their eyesight. The National Society to Prevent Blindness say that 90% of all eye damage is preventable. To protect your eyes, always wear safety glasses or goggles when using power tools, lawn and garden equipment, and other machinery that slings dirt and debris. Be careful not to let fumes from solvents and cleaning agents burn your eyes. If a foreign object gets into the eye, do not rub the eye. Rubbing might scratch the cornea, and that can damage your eyesight. Have them blink their eyes. the tears might flush out the object, and if that doesn't work, wash your hands with soap and water, then try to flush out the foreign particles with clean running water or clean water poured from a glass or bottle. You're going to have to help them with this because it's kind of an uncomfortable sensation to have somebody pouring liquid in your eyes, so you can have them lay down, head back, help them keep their eye open with clean hands, bottle of water, or they can do it under the faucet. Foreign matter that is embedded in the eye or that will not wash out must be treated by a doctor. Stabilize the object if it is possible and cover the injured eye with a dry, sterile gauze pad. Take them to the emergency room. Nosebleeds. Nosebleeds might look bad, but they are normally not very serious and will usually stop in just a few minutes. The bleeding usually stems from a small vein in the nose and can be caused by irritation to the area from colds, allergies, picking, cold and dry weather, and overuse of nose drops or sprays. Have them lean slightly forward. You pinch, I'll take my glasses off, maybe you can see better, kind of where the bone in your nose starts, pinch there, slightly forward because you don't want the blood running down their throat, that can make them sick. And then apply a cold pad to the bridge of the nose while maintaining pressure. After about 10 minutes, have the person slowly release the nose pinch. If the bleeding reappears, pinch and apply the cold pack and pressure once again. After the bleeding stops, do not irritate, pick, or blow the nose for several hours. If the bleeding continues for more than 15 minutes, seek medical attention. Alright, we're going to move on to poisonous plants. This is not going to be the same for everybody. I know in the state of Iowa here, I don't believe that we have poison sumac or poison oak. I'm not sure which one. We have a ton of poison ivy. We have a ton of poison ivy here at camp. I was lucky enough to get some on my foot the other day because I walked off of the trail in sandals, which was not a smart thing to do. Learn from my mistakes because poison ivy is really irritating and not very much fun. All of these poison oak, poison ivy, and poison sumac is caused by an oily sap on the leaves, stems, and roots. It irritates the skins of most people. Some people don't have a reaction to it. I don't have a very severe reaction to it. Our camp ranger has a very severe reaction to it. So it just depends on the person. I got it on my foot the other day and washed it and treated it, and it was gone. So if the ranger gets some on his arm, he'll blister up, and even if he treats it and washes it, it'll continue to be irritating and itchy and red, and you can see it for days. Be careful not to spread the sap once you get it. It can cause a rash with redness, blisters, swelling, and itching, or burning. It can also cause fever and a headache. The severity of the reaction depends on the individual. And the best form of prevention here is to learn to recognize them. There are pictures in your book. And I don't know, I said in different parts of the country here, we're fortunate enough to have scouts from all over the country, so be familiar with what's in your area. If you're not sure, ask an adult, ask your Google machines, your computers. A lot of people say leaves of 3 let it be, because that's true for both poison ivy and poison oak. White berries are another signal of a poisonous plant, although not all plants with 3 leaves or white berries are poisonous. Just make sure I don't ever go hiking in the woods unless I'm wearing boots and pants, of course, except for the other day when I stepped off of the trail for a second in sandals. So I should have looked a lot more closely than I did because I wasn't wearing proper clothing. Usually it has to be 10 to 20 minutes before you start getting an irritation. It can cause problems spreading if you get it like on your hands and you touch your face. That can cause a problem. So immediately stop and wash the exposed area well with soap and water. Wipe with rubbing alcohol and apply a lotion or some other sort of soothing, like calamine lotion or other soothing skin treatment. If the reaction is severe, or if the genital area is affected, if plant parts were chewed or swallowed, or if contaminated smoke was inhaled, seek immediate medical attention. That's because you're going to get blisters in your lungs if you inhaled the smoke. We're really careful out here about what we're burning because the poison ivy especially can be viney and climb up sticks and wood that we're working on. So change your clothes and wash them separately. I recommend dish soap. Dish soap is going to be the best thing for cutting off that, cleaning off that sap. Talks here about some dental injuries, what to do. I believe it's still one of your requirements here, what to do with a broken, chipped, or loosened tooth. So gently rinse the mouth with warm water, place a cold wet cloth or pad in the area of the injury to minimize swelling, and see a dentist immediately. Take the broken or chipped piece of tooth along. If you get a tooth knocked out, you pick up the tooth carefully by the crown, not the root. Rinse the tooth gently under cold water or milk if it's available. yeah, don't scrub or scrape the root of the tooth, and do not allow the tooth to dry. Flush the wound with clean water or a saline solution, and apply pressure with a clean cloth or gauze to stop any bleeding. Place the tooth in a container of milk or cool water and take them to the dentist, ideally within 30 minutes, because I think if you catch it within 30 minutes, or even longer, sometimes they can just reseat the tooth, the same tooth. You can reimplant it and it'll stick, but that's something that a dentist is going to have to do. Bites and stings. If you guys are scouts, chances are you've been camping. We know that in my part of the country anyway, mosquitoes are definitely a problem in the summer. We have a lot of we have bad tick years up here too. I think only one person that I know of a couple of people that I know of this year have had ticks on them. So I know some parts of the country right now are experiencing really high tick numbers. So I don't know if you guys can see in the camera here, but I've got quite a few flies buzzing around me. So we get fly bites. Big horse fly bites are really painful. The bites of mosquitoes, chiggers, and no-see-ums are irritating but not usually dangerous. We get a lot of the no-see-ums in the fall. We get a lot of, we do get chiggers, sand fleas, that kind of thing. So to avoid getting bitten by ticks, wear long pants and a long sleeve shirt whenever you are in tick-infested woodlands and fields. Button your collar and tuck your pant cuffs into your boots or socks. Inspect yourself daily, especially in the hairy parts of your body, and immediately remove any ticks you find. Ticks bury their head beneath the skin of their victims. To remove a tick with gloved hands, grasp it with tweezers close to the skin and gently pull until it comes loose. Don't squeeze, twist, or jerk the tick, as doing so could leave the mouth part still buried in the skin. Wash the wound with soap and water and apply an antiseptic. That's where I made a mistake on a tick bite once, as I pulled it out and didn't wash the area, and I did end up with an infection. So make sure you get that tick out of there and wash it up. Thoroughly wash your hands after handling a tick, because some ticks carry disease. You should seek medical attention if you get sick or develop a rash after being bitten by a tick. The female black widow spider, which we do have in Iowa. I've never seen one, but I understand they're here. The female black widow is the one responsible for bites. It's glossy black with a red-orange hourglass marking on the underside of its abdomen. These spiders like to dwell under stones and logs, in long grass, brush piles, barns, garages, latrines, and other shadowy spots. Its bite can cause redness and sharp pain, sweating, nausea, and vomiting, stomach pain and cramps, and severe muscle pain and spasms. Breathing might become difficult. Here in Iowa, we also have brown recluse. I have been bitten by one. It causes the tissue to die, and I have a big scar to prove it. And some people can have a even worse reaction to that. So the big one is to be careful, like around wood piles. We split a lot of firewood out here, and it's piled up. I always knock on the wood pile, bang on the wood pile before I start moving much of the wood, because you're sticking your hands in there. Put gloves on. You're sticking your hand in a wood pile, put gloves on. That's where a lot of these spiders like to hide out. Under loose tree bark is another place. You might not notice the bite at first, but within 2 to 8 hours, there will be a mild to severe pain with redness at the bite site. The area becomes swollen, tender, and a small blister usually forms, followed by an open sore. The victim might suffer fever, chills, nausea, vomiting, joint pain, and a faint rash. Wash the bite with soap and water and apply a cold ice pack to the area. Seek medical attention immediately. I didn't have much in the way of pain with it, and I didn't get any nausea or vomiting, anything like that, but it ended up leaving a big open sore, so that took quite a while to heal, and I have a really big scar to prove it. So always be mindful of that thing, or those kind of things. Fire ants. I know in a lot of part of the country here, you guys have fire ants. The sting of a fire ant can be extremely painful. If disturbed, fire ants will swarm and attack cooperatively and aggressively, often grabbing hold of the victim's skin and stinging repeatedly. Be careful not to break the tiny blisters that form from the stings. Wash the injured area well, using antiseptic or soap and water. Cover with a sterile bandage, and for relief, you can make a paste of baking soda and water, and take a mild non-aspirin pain reliever like Tylenol or ibuprofen. The blistered area should heal within a week. Some people are highly allergic to fire ants, and that can cause anaphylactic shock, and we're going to talk about that. If you're stung by a bee but are not allergic to bee stings, you can simply remove the stinger by brushing it out with a flat-surfaced object such as a credit card. Don't try to squeeze the stinger out. Doing so will force more of the venom into the skin from the sac attached to the stinger. For bee, wasp, or hornet stings, use an ice pack to help reduce pain and swelling. There's a couple of different examples of bees and wasps here, just for a picture. The common scorpion. Luckily, we don't have those in Iowa, but I know we do have a fair amount of scouts here from Arizona, Oklahoma, the Southwest. You guys do. So, common scorpion stings often cause severe sharp pain with swelling and discoloration, but generally cause no lasting ill effects. An ice pack or cold compress should help relieve any itching and pain. An over-the-counter antihistamine may help relieve symptoms like diphenhydramine or Benadryl. However, if the victim has a history of allergic reactions to insect stings or shows signals of illness, seek medical help at once. Animal bites. The bite of a dog, cat, or any other warm-blooded animal is a serious puncture wound. The animal might suffer from rabies, which is a deadly illness that can be transmitted through the saliva of some animals, in particular dogs, skunks, raccoons, foxes, and bats. The only way to learn if an animal is infected is to catch it and have it tested by medical experts. An unprovoked attack could be a sign that the animal is rabid. Report all animal bites to your local public health authorities or the police. Do not kill the animal unless necessary, and do not put yourself at risk trying to catch the animal. Call the police, your park rangers, or animal control officers who are trained to do the job safely. Suspicious animals may be confined and observed, or destroyed so that their brains can be tested for rabies. To treat an animal bite, scrub the area with soap and water, and if at all possible, flush the wound with clean water for a full 5 minutes to remove the saliva that might carry the rabies. Control the bleeding and cover the wound with a sterile bandage. The victim must see a doctor who can determine whether to give rabies shots. Rabies is almost always fatal in humans, so don't skip the doctor part on this one. If the bite is that of a pet dog or cat, get the name, address, and phone number of the owner if possible. If bitten by a wild animal, do not try to capture it. Instead, have someone make note of the type of animal, its description, and the direction in which it was headed, and then contact the local public health authorities to report the bite. Snake bites. The bite of a non-venomous snake causes only minor puncture wounds that can be treated as such. Since they're not warm-blooded, they don't carry rabies. Scrub it out with soap and water, just how you would treat a cut or abrasion. The venomous snakes of North America are pit vipers and coral snakes. Pit vipers include rattlesnakes, copperheads, and cottonmouths, and they have triangular-shaped heads with pits on each side in front of their eyes. Signals of a pit viper bite include puncture marks, pain, perhaps extreme, and swelling, possibly severe, skin discoloration, nausea, and vomiting, shallow breathing, blurred vision, and shock. Coral snakes have black noses and are marked with red and yellow bands side by side, separated by bands of black. They inject a powerful venom that affects the victim's nervous system. So first aid here, we get them under medical care as soon as possible so that the physicians can neutralize the venom with an anti-venom. You always want to try to figure out what kind of snake it was, but don't chase it because the anti-venoms are specific to the type of snake. Remove rings and other jewelry that might cause problems if it swells. If the victim must wait for medical attention, wash the wound. If the bite is of a venomous snake, wrap the area snugly but comfortably with an elastic bandage. Check frequently for circulation. Have the victim lie down and position the bitten part lower than the level of heart. That can slow the spread. Encourage them to stay calm. If the heartbeat is rapid, that can cause it to spread, and treat for shock. This is one of the reasons why I always carry a walking stick with me in the woods. If you have to move a log or something, you can use your walking stick, or you can use it to rattle the bushes or bang on the rocks or something if you got to lower yourself over a rock bank or something. Do not give a snakebite victim alcohol, sedatives, or aspirin. Do not apply ice. Ice will not help the injury, but it could damage the skin. So we're going to move on to a couple life-threatening injuries that we have not covered, and then I'm going to be done with you guys here, I think, for the first aid. We're also going to be doing some wilderness survival and search and rescue merit badges, so those will be in separate videos. You guys need to do some research on your own about AEDs. They're automated external defibrillators. I don't have one here available to me, so I don't have I can't make an instructional video on how to use one. That's part of your homework. Look that up. I know you can find plenty of videos of that on the old interweb, so look up a training video for an AED and watch that and memorize that. Same thing with CPR. I don't have a CPR dummy here. You guys should get CPR certified. I'm going to go over it according to your book here, but you should definitely get some formal training from a CPR instructor. CPR is different for victims of different size, so obviously you're not going to give the same CPR to a baby than you are, me. All right, so compressions for CPR. Signals of circulation mean that the heart is still beating and circulating blood throughout the body. Normal breathing and movement are signals of life and that there is a heartbeat. If there's no signs of life and no breathing, begin chest compressions. Again, in my class, I was taught if you're not breathing, you're getting CPR because the heart's not, if the heart is still working, it's not going to be for long. So you go ahead and start compressions at that point. Accidents or medical conditions that cause a person to stop breathing can also stop the heart. If the heart is not pumping and circulating blood through the body, the victim will not be breathing, moving, or making much normal sound. You should immediately perform CPR, which stands for cardiopulmonary resuscitation, and continue cycles of CPR of 3 chest compressions and 3 breaths. Do not stop CPR except in one of these situations. The AED is ready to use. You find obvious signs of life such as breathing. Another trained responder or EMT arrives to take over. You become too exhausted to continue, or the scene becomes unsafe. It shows you here for an adult, use 2 hands. For a child, you can use 1 or 2 hands, and for an infant, 2 or 3 fingers. The cycle of 30 chest compressions followed by 2 or 3 breaths applies to everyone, and you should definitely go and get more advanced training on that. For breathing, you get a face mask. All of our first aid kits out here at camp have a mouth guard or a face mask. You don't want to expose yourself to their saliva. Check to see if they're breathing normally, and if you have to do breaths, you place the CPR breathing barrier over the victim's mouth. Give 2 rescue breaths while maintaining the head. You tilt the head back and pinch the nostrils. There's a good picture in here of how that straightens out the airway. For an infant, you seal your mouth over the nose and the mouth because you can't pinch it in. Give breaths, and each breath should last about 1 second. If they revive, put them in the rescue position, or the recovery position that we talked about. The signs of getting a disease are pretty low, but you still want to protect yourself and them. Always use a mouth barrier if you have one available. For choking, if they're conscious, give 5 back blows. So from behind, you place 1 arm across their chest and lean forward and firmly strike their back with the heel of your hand. Follow 5 back blows with an abdominal thrust as described. And Craig had to go home, so I don't have another person here with me to demonstrate this. So there is some good diagrams in your book here, but you stand behind the victim. I can show you just on me. Put them around your waist, make a fist, and place the thumb side against the body just above the belly button here. Cover your fist with your other hand like this, and you thrust your clasped hands inward and upward with enough force to pop loose the obstruction. Do this up to obstruction. Do this up to 5 times if needed. Repeat steps 1 through 3 if it still isn't coming clear. So repeat the back blows and the abdominal thrust. Belly button's here, right above the belly button, and you go up, in and up. Can kind of touch on tourniquets here. We don't really recommend that you use them anymore. It used to be a pretty widely thought thing to do is to apply a tourniquet, but that can cut off blood flow completely and damage the tissue. Use a strip of cloth if it's a severe case and you're not able to get the bleeding to stop. You could use a tourniquet. It's just a last resort method. A tourniquet will completely stop blood flow to the limb, and it can cause gangrene or tissue death, and they might lose the limb. So in the past, field tourniquets were made from a strip of cloth at least 2 inches wide, never cord, wire, rope, or any other thin material because that can cut them. The strip is tied with an overhand knot above the wound, and a stick, tent peg, or similar rod-shaped object was placed on the knot and tied down with the square knot. The stick was then twisted just until the bleeding stopped and then secured to the tourniquet so it would not come loose. Today, if a tourniquet must be used, it is generally a commercially made device designated for the specific purpose. I have one in my big kit that is in my truck. I have a commercially made tourniquet that uses Velcro and a plastic rod. Once a tourniquet has been applied, a written note of the location of the tourniquet and time it was applied, and attach that to the victim's clothing. Just as you should be filling out a card of all the things that we talked about earlier, you need to note the time. As soon as the bleeding slowed or stopped, then you can start to slowly loosen the tourniquet. You want to do this so that you're not killing off the tissue and causing the gangrene. If you loosen the tourniquet and the bleeding immediately starts up again, reapply it. Pause here very briefly while I go get it because I have a training EpiPens. Alright, we're back to talk about anaphylactic shock, and then I'm going to let you guys go here. For most people, a bee or wasp sting will cause pain, redness, and a little swelling, and maybe a few days of itching, but a small number of people are allergic to bee or wasp venom or fire ant bites. These stings can cause a life-threatening reaction called anaphylactic shock or anaphylaxis. Symptoms can include a swelling of the throat tissues or tongue that restricts air passages and makes breathing difficult or even impossible. Some people are allergic to shellfish or peanuts or certain things in the environment, that kind of thing. If they're severely allergic, it can cause the throat to swell. I have had an anaphylactic reaction to something, and we still haven't figured out what it was. It was a couple years ago, but some kind of an allergen. It happened once. It's never happened again. So, but I did have to go to the hospital. I did get epinephrine, so it's scary. Any scout who has an allergy that could cause anaphylactic shock should share that information with the scout leaders and always let the group leaders know where he carries his anaphylaxis medication so that they can be made available at a moment's notice. First aid, call 911 immediately. Step 2 is to check the victim for medical ID bracelet, necklace, or information card. Ask them if they're carrying a prescribed emergency medical kit, such as an EpiPen. You may be able to assist the person under certain circumstances, and if you are trained and allowed to assist by state and local regulations. If so, follow the kit instructions exactly and assist the person by locating the medication kit and handing it to him or her. It is best that the individual administers the medication. If the person is unconscious, follow the ABCD life-saving sequence and or follow instructions provided by emergency medical professionals. Step 3 is see that the victim receives follow-up treatment. If you're not qualified to administer epinephrine, you should help make sure the person stays as comfortable as possible to maintain breathing, and this will usually be in a sitting position. Life-threatening food allergies are rare. However, an increasing number of people suffer from food allergy reactions that, although not life-threatening, can cause great discomfort. If you have a food allergy, always be sure to let the scout leaders know about it. This is the reason why most schools around the country, certainly schools in Iowa, don't allow peanut butter even in the school anymore because peanut allergies are fairly common. People that are susceptible to anaphylaxis should carry emergency kits that contain an injection of epinephrine, which is a rapidly acting medicine that temporarily reverses the effects of anaphylactic shock.